Hello everybody, my name is Sofia Berseno, and as some of you may know, I'm currently raising funds for an organization called Partner for Surgery. And Partner for Surgery is a wonderful organization that goes and provides life-changing medical assistance to some of Guatemala's most impoverished communities. So I'm joined here today by Ariel. He's the Director of Operations for Partner for Surgery, here to tell us a little bit more about the work done by Partner for Surgery. So Ariel, what is your role in Partner for Surgery?
Hi Sofia. My role in Partner for Surgery is I'm the Director of Operations, and I manage the communications, logistics, and any details that go on to be able to have rural missions that take place in the rural areas, and to be able to have also the surgical missions. So we have 5 rural missions a year, and we have 12 surgical missions a year, and we manage all the communications, details, all the logistics to make sure that everything takes place so that we have a successful rural mission and surgical mission.
That's awesome. So I'm so excited to be coming down on one of these medical missions in February. Can you give us a little bit more insight as to what goes down on these medical missions?
Of course, we're very excited that you're coming as well. The rural missions are missions that help us to put together an international team with doctors from the United States or Canada, non-medical volunteers as well, and we are able to go for a week into the rural areas. We work in 4 different clinics, and we are able to evaluate and identify patients who need a surgery. These are patients who have had conditions for 10, 15, 20 years, and they don't know what actually they have. Unfortunately, the national system hasn't been able to help them, so we're able to provide the care that they need. Sometimes it's just answering questions and evaluating the patients so that they will have answers to what their problem is. These missions, there's a lot of logistics into this, but we're able to accomplish this by connecting with the Ministry of Health, you being able to use their clinics, the hospitals. We do a lot of promotion for the mission so that the patients that will come to us are actually surgical candidates. And we also accomplish this with the support of health promoters.
Wow, so what are these health promoters and what is their role?
Of course, the health promoters are very important to us. It's actually something that helps us to be unique in Guatemala. These are people from rural Guatemala, and they speak the Mayan languages. They're known in the communities, and they accompany the patients in any step of the way of the logistics to be able to help the patients to achieve their surgery and healthcare.
That's fantastic. So how can I be of support on the medical mission?
Well, there's going to be many ways that you're going to help us, Sofia. You will help us with many of the pictures, the videos that are going to be taken during the mission, some of the house visits that we're going to be able to make as well. And you're going to be helping us with the logistics of the patients, taking patients back and forth. You're going to be helping interpreting to Spanish. You speak Spanish, so that's a big help for us. And just many of the details that take on the mission. We have a small pharmacy and a small lab, so we give away a few medication to the patients that need something. So you're going to be helping us in many things, and that's why we have non-medical volunteers on these missions. There's many roles actually for volunteers in our rural missions. It's not strictly medical, it's also non-medical volunteers.
Awesome. I'm so excited to be able to help on this medical mission, and I really appreciate the opportunity.
No, we're very excited to have you, and we know that it's going to be a great experience for you.
Yes. So do you guys only evaluate patients for surgeries on these medical missions?
No, actually that's a good question, Sofia. We do have other programs that take place in this mission. So we have the cervical cancer educational and evaluation program, where we bring a small team of nurses who have been certified, and they are able to provide what is called a VIA, visual inspection with acetic acid, into women in between 25 and 55 years old who have never had a PAP or any evaluations done. And this is to avoid or prevent cervical cancer. Cervical cancer is the leading cancer in Guatemala, so that's why this program is very important. And we also have the breast cancer educational and evaluation program, where one of the doctors is going to be teaching women on self-tests and also evaluating women about breast cancer. So this also takes place and is very important for us in the missions. And complement to this is also finding children with cleft lips and cleft palates to be able to put them in the nutritional program that we have only for cleft lips and cleft palate patients.
That's awesome. So once people are identified for needing surgeries, what happens?
When the patients have been determined that there is a possibility that they need surgery, they're scheduled into our system, and we, of the 12 surgical missions that we have, we let them know what dates it's best for them, and it also depends on the specialty that they need the surgery for. And they are connected with one of the local health promoters, and then the health promoter is going to be accompanying them, translating, being with them during the process. So they're scheduled for the surgery, they connect, and then they travel into Guatemala City or into the hospital in Antigua, Guatemala, and they stay in the city or in Antigua for several days, but the health promoters are with them. So the rural missions are a link of determining that the patient needs surgery and connecting them into the surgical missions with the different surgical teams that we have from the United States and Canada.
That's very important. So thank you so much, Ariel, for being here, for sharing some information about the valuable work done by Partner for Surgery, and for coming all the way from Guatemala. I really appreciate you being here.
Oh, thank you, Sophia. Thank you for having me over. It's our pleasure, and we look forward to having you in February in the rural mission.
I'm so excited. So, thank you guys so much for watching. Please consider making a donation. I will be covering all my own expenses, so all the money raised will go directly towards the patients that Ariel has talked about. Thank you.